Gynecomastia or male chest enlargement is the development of glandular tissue in your chest. This gynecomastia or glandular enlargement causes you to change your clothing style. It affects your confidence and also affects your social interactions. This typically affects people when they are in the young age, when they have their growth spurt, which is called puberty. So it's a topic which is very embarrassing for men to come and approach a doctor, but when should you approach? It's a topic that many men are embarrassed to talk about, but it's a condition that is much more common than you think. It affects young men as well as boys. I am Dr. Aneesh, and in this video, I'll be discussing what is gynecomastia or male chest enlargement, what causes it, how do we diagnose it, and how do we treat it, and how a simple procedure can help you transform your life. Gynecomastia or male chest enlargement is the development of glandular tissue in your chest. Similar to how females have breast tissue, males can develop glandular tissue. This gynecomastia or glandular enlargement causes you to change your clothing style. It affects your confidence and also affects your social interactions. When it comes to gynecomastia, what you need to understand is that it is typically caused because of an imbalance in the hormone within your body. Typically, when the estrogen levels slightly go up with relative to the testosterone, there is stimulation of the gland, and this glandular stimulation leads to chest enlargement. This typically affects people when they are in the young age, when they have their growth spurt, which is called puberty, and during that time they will suddenly notice an increased enlargement of chest. Some adults may also develop gynecomastia when they are taking certain medications or they have certain other medical conditions. In fact, certain old men, when they grow old, because of the reduction in the amount of testosterone in the body, can also develop gynecomastia. So it's a topic which is very embarrassing for men to come and approach a doctor, but when should you approach? When would be the right time? So when it comes to gynecomastia, when you have an enlargement of your chest, when you develop pain around the nipples, when there is some chance of nipple discharge, you should definitely approach your doctor. When it comes to gynecomastia, your board certified plastic surgeon will have an examination, will tell you exactly how your gland is, what is the amount of fat that is present around the gland, and also take a complete wholesome medical examination to rule out other conditions, and also the history of taking any certain supplements or medication that might stimulate a gynecomastia or gland production. So now that you have known what is gynecomastia, how do we approach and how do we diagnose it, it's important to know how do we treat it. So gynecomastia is treated with a very simple procedure which is called liposuction and gland excision. It is slightly different in certain people who have only fatty tissue in the chest, which is called pseudogynecomastia, in which case probably a liposuction alone will help. But in typical cases of gynecomastia, the treatment is liposuction and gland excision. So the liposuction is done to remove the fat component and the glandular excision is done to remove the glandular component. When it comes to liposuction, the ports are placed in hidden incisions and which are discreet so that no one knows that you have undergone a procedure. And the glandular excision is done through an infranipple approach, wherein after the scar heals, people will not be able to perceive any kind of marks that are stigmatic of the surgery. Now, depending on the size of the chest that you have, we may also need to add a specific procedure which is called skin tightening. We at Tamira typically use radiofrequency skin tightening, which is called a body tight platform, and that helps us to tighten the skin which has been stretched out because of the enlargement of the chest. This radiofrequency skin tightening will help you achieve a more chiseled look and give you a more masculine appearance. This procedure is a daycare procedure which is done under general anesthesia, and the typical procedure would last somewhere close to an hour to 2 hours depending on the size of the chest. Once the gland as well as the fat has been removed, the patient is shifted back to the recovery room, and probably by the evening the patient is fit to go home. When it comes to the chest shape becomes immediately flat after the procedure, but there is some amount of swelling. Probably the swelling will reduce in 3 to 5 days. We will also give you something called as a compression garment. This compression garment will help you keep the pain under control, will also reduce the swelling, and will keep you comfortable as well. The overall chest shape will take probably a few months to reach. You can start your cardio exercises from probably 1 to 2 weeks onwards, and you can start full chest exercises from 3 to 4 weeks onwards. Although I did mention that this procedure is a very simple and safe procedure, there are certain complications that can happen, but with the right care and expertise, we can make sure that these complications are prevented. The common complication that can happen is there may be fluid accumulation, there may be sometimes blood accumulation. Also, there, because the liposuction has been done closer to the skin and the gland has been removed from the nipple, there is a chance that there may be some amount of change in the sensation that is present around the skin, but which will recover completely in probably 3 to 6 months time. Overall, the chest shape or the final result that you are looking for will be achieved in probably 3 months time. Gynecomastia surgery can be a very simple procedure, but it can help you transform your life. Subscribe to our channel and share this video with someone who would benefit from gynecomastia surgery.